series. This is, of course, Learning or Becoming a Doctor 101. The way that this is going to work is I'm going to kind of go through like a short presentation, kind of give you basics and overview. And then inshallah, we will have a question session that you guys could be interactive with us. I ask that if you have questions throughout the entire presentation that you type them up in the chat box. That's how we're going to be monitoring for questions. And even for the question session, we'll be answering questions directly from the chat box. So that's the best way to communicate any questions that you may have, inshallah. So before starting, of course, we want to just connect this back to our deen. Why knowledge is important. In the first, few ayahs of Surah Al-Alaq, it tells us, اقرأ باسم ربك الذي خلق خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم, which I think a lot of us take inspiration for knowledge gaining through these ayahs. And so it's always a great reminder to see that Islam is a religion that encourages gaining knowledge, which is something that you'd definitely be doing as a physician. So this program is brought to you on behalf of AMWPA. So AMWPA is an organization that's dedicated to the improvement of women's health, to providing a platform for Muslim women in medicine, and for raising awareness of issues like community welfare. They do a lot of events. The ones that I've most been involved in are the free health fairs that they hold at the various mosques around the DFW complex. They provide free medical care, free dental care, optometry, a whole bunch of things. And it's really beneficial for individuals who are underinsured or don't have insurance. MashaAllah, they serve such a large population. One of their more recent projects is the mass donation project. MashaAllah, they donated at that 8,013 masks so far. Quite impressive. So if you are someone that is interested in exploring medicine as a career option, or you are interested but you don't know what to do to get there, or you're unsure of how to set yourself up to be a strong applicant, and you're nervous about being able to handle medical school, you're in the right place. We are a panel of medical students that are going to be kind of walking you through the common problems that people encounter when they're trying to get into medicine. So I thought we'd go out and introduce ourselves. This is me. I'm Aseel Ali Dweik. I'm a fourth-year medical student at the University of Texas at Southwestern here in Dallas. I'm interested in pursuing internal medicine, and I'll be applying for that this year, inshallah. This is a picture that I chose because to me, this is like probably one of my most favorite memories from the entire medical school. This is me with my surgery team on the top of Parkland Hospital with the Dallas skyline in the background. And as you can see, we're clearly living our very best lives. This is Dina. Dina, if you're there, could you please introduce yourself?
Oh, okay, I unmuted. Can you guys hear me? Can you hear me, Aseel?
I can.
Oh, okay. Hi guys, my name is Dina. I am a third-year medical student at UT Southwestern. And I'm really happy to be here to talk to you guys about this. If you guys have any questions, feel free to ask them in the chat. I'm interested currently in either family medicine or psychiatry. I'm really passionate about community medicine and giving back in the Muslim community. So if you're interested in any of that, let me know.
Great. Thanks, Dina. Our next medical student is Waqas. Waqas, if you're there, could you introduce yourself?
Hey, assalamu everybody. I'm Waqas. I'm a fourth-year student at Southwestern. I'm a classmate of Aseel and Dina. So I'm interested in internal medicine and also was active in the AMWPA's health fairs a couple years ago. I took a gap year last year to do a public health degree in Baltimore. So if you have any questions about a non-traditional path of medicine or about incorporating other aspects of care upstream of clinical care, I'd be happy to answer questions on that during the Q&A, inshallah.
Thanks, Waqas. So the next medical student is Samar. I don't think Samar is on yet, but she is a second-year medical student at TCOM, and she will be joining us, inshallah, for the Q&A session. So let's go ahead and look through the outline. So the outline of today's talk, essentially, we're going to be looking at a broad overview of the medical journey, what it takes essentially to become a physician, high school, college, medical school, kind of like the breakdown of what are important in each step of the way, and then the question session, inshallah, at the end. So medicine is a little bit of a long road, right? There's typically a 4 years bachelor's degree plus or minus 1 year for, you know, if you want to take a year off between bachelor's and med school, 4 years of medical school, 3 to 7 years of residency, depending on the specialty you want to pursue, plus or minus fellowship, which can be anywhere from 1 to 3 years. And then you're finally a doctor, right? It seems really, really long, but trust me when I say that it's worth every second of the ride. It's really such a wonderful career. But the necessary tools that you need to be successful in this profession is the intention of pleasing Allah first and foremost. A lot of hard work, passion, and commitment. But with those tools, you'll be very successful, inshallah, in this field. So I thought we'd start off with high school. I know definitely my interest for medicine sparked in high school, but I felt like I was at a crossroad. I wasn't really sure if med school was for me or if I was interested in pursuing some other science degree. I think one of the best things that you can do for yourself in high school if you're interested in medicine is get exposure. So one of the ways, or a few of the ways that I would recommend is shadowing. For instance, you go to Parkland Hospital and you're interested in surgery, you could shadow a surgeon in the OR and kind of see what they do, what their life is like, what the day-to-day cases look like. You could also shadow in a clinic if that's more your style. I know a lot of people volunteer in the emergency departments in hospitals and they find that to be very fulfilling. AMWPA is a great resource because these free health fairs are kind of really low stress environments. You get to interact with people from all stages of the path, so medical students, residents, and physicians. So you kind of get to like see what each stage looks like. And then UT Southwestern has an event called United to Serve. It's like a huge health fair that we host annually at a middle school near Parkland. We give free medical care and dental care to people living around that area who come from poor backgrounds or who are underinsured, people who don't, you know, have insurance, or people who are undocumented. So we serve a really, really large community, and it's a lot of fun. There's games, there's kids, you can kind of volunteer in whatever you essentially like. So it's really, really nice. So these are some ways that you can get exposure. You know, this is a good way to gauge whether or not medicine is something that you like, because I think medicine has more to it than just liking sciences. You kind of also have to like interacting with people. You kind of have to like, you have to be okay with uncertainty, because there's definitely a lot of uncertainty in medicine. And so I think this is a great way to get yourself some exposure. So freshman year, so an 18-year-old previously healthy college student presents to my clinic with chief complaint of unrelenting confusion for the past few months. She says she's confused and it's exacerbated by aunties asking me what I want to do with my life and the pressure of making the right choice. When you evaluate her, you determine that, as with many pre-med students, she suffers from the degree dilemma. She doesn't know what kind of degree she wants to pursue. So she asks for your advice and requests treatment for this confusion. So which of the following has evidence-based medicine determined to be the superior choice? I get this question all the time. What degree should I pursue? What do I need to do to get into medicine? And the real answer is there's no single best answer. And I'll give you an example. My younger brother is actually interested in going to medicine. He just graduated high school. And he was talking to me about this same question just like a few days ago. And the advice that I gave him was that pursue a degree that you like and that you will do good in. So he's really good with computers. So after that discussion, we essentially came to the conclusion that he was going to pursue computer science with the intention of doing med school afterwards. And it's doable. The most important thing in college is that you explore your other passions in life, because you'll realize after you become a doctor that you're not just a doctor, you're a whole human being with lots of passions and lots of interests. And I think college is a great time to explore that. The only thing is that if you do choose a degree that does not have science as like the main component, you would have to work with your advisor to try to fit in your pre-med classes like biology, chemistry, biochem, physics into like your elective periods. So, you know, for instance, my brother Hamza would be pursuing like computer science degrees, and then he would take biochem as an elective so that he fulfills both requirements, computer science and pre-med. So choose something you love and something that you know you're going to do good in. And then here are some classes that I just recommend for people, depending on what they like. So if you're interested in like if you're interested in like policy or economics or kind of understanding the way healthcare administration works, I'd recommend you take healthcare econ. Public health is a huge topic right now, as you can imagine, with coronavirus. Public health is kind of the study of disease trends in a large population. So kind of looking at coronavirus trends over a period of time. That's something public health is really good for. Cultural competence in healthcare. I think cultural competence really makes a humanistic physician. So if you're interested in getting more of like the stylistic things that could help you with becoming a physician, I'd recommend that. Anatomy and physiology is one of the science classes that I would recommend people to take, not because I think it'll make a huge difference when you go to med school, but because I think anatomy and physiology has a lot of memorization, and it's just nice to have some familiarity with the terms, you know, to know what certain structures are, not necessarily remember everything about them, but to at least be able to recognize the name. Sociology and psychology, I know, are added onto the new MCAT, so I think those are pretty great, and they also help you with being a good physician, being able to connect with patients. And medical terminology, again, for the same reason. If you want to have name recognition, I think it's really helpful to at least know the terms. So sophomore year. Sophomore year is really when you want to try to start picking and choosing what extracurriculars you want to be involved in. My biggest advice is quality over quantity. You do not need to have everything as a pre-med student. I know there's a lot of pressure. I know when you look around, everyone seems like they have everything and they have everything all together and they're just like the star applicant. But trust me when I say med school likes to see quality and commitment over quantity. If you want to pursue research, great. If you don't want to do research, that's okay too. But what's important is that if you do research, you need to stick with one lab. You need to do it for, you know, at least a year. More than that is great, but they want to see commitment. They want to see that you liked something and you stuck with it. I think that speaks so much more than just, you know, being involved in tiny little things here and there. Volunteering, you could do medical volunteering, you could do non-medical volunteering. You don't have to just do health-related stuff. So you could do chess club if that's what you like and you want to do that. Do chess club as long as you have like a commitment to it and you show that, you know, this is something you're really passionate about. They actually love that. And I know, for instance, I was really into gardening, and so I put that on my application because it's something that I really love to do, and that was brought up more than once at so many different interviews. So yeah, being a whole like well-rounded human being is something that med schools like to see. And leadership is something that might be hard to attain in sophomore year, but I would say to keep it on the tips of your brain so that you set yourself up so that at least junior year you have the opportunity to be involved in some kind of leadership position. Again, pick a few, not all. Pick something you like, not necessarily something you feel like you have to do. If you don't like research, you don't have to do research. And yes, I promise you that's the case. So I know that COVID has put a lot on hold, and I mean a lot, and it can be really, really stressful. I totally understand because I'm currently in the process of trying to apply to residency, and COVID has definitely not made it easier than I would like. So I think some ways that you can stay active and some things that you can continue to put onto your resume during COVID are things like volunteering with AMWPA with the mask distribution. I think that's a great way to get involved, and it shows kind of like your commitment to medicine. And then there's like a few organizations that do COVID contact tracing things and information hotline. These are things I think you can do from home. So if you want to, you know, be extra safe and not leave the house, and, you know, like social distance, these are definitely things that you can get involved with at home. So I would recommend these two if that's something that, you know, you need at this point in your career. Junior year is really important for the MCAT and for the application. The MCAT, I get lots of questions about this, and this is my 2 cents on the MCAT. I would cut out 3 to 4 months in my mind that this is how much I'm going to need to study for an MCAT. Some people study less, some people study more. It just varies kind of depending on your studying style. And when it comes to Kaplan versus Princeton versus neither, I would say I did Princeton, but only for the sole reason of I was not disciplined enough to study on my own. That is literally the only reason I did that. It wasn't like I got so much out of Princeton and I would like highly recommend it. If you're a disciplined person and you're able to study on your own at home, you definitely don't need any of these programs. All you need is practice books to do questions, and you need practice tests is what I would say. When to take it, I would recommend taking it in January. This is because in case you don't do well, you still have time to retake the MCAT before applying. And I really want to press on this. If you have to retake the MCAT, it's okay. Like, it's not the end of the world. Of course, it's always best to do, you know, a one and done kind of situation. You do great on the first one. But if you need to retake it, it's really not a big deal. I know so many friends with me at Southwestern who have took the MCAT 2-3 times, and it doesn't, I wouldn't say it looks bad. I would say that if you have like a low score on the first one and you jump to a higher score on the second one, that shows improvement, if that makes sense. Application. So I know I went to UTD, and I know that UTD has the HPAC office, which is essentially a health professions office that helps you with the application. You need to get hooked into it in November of your junior year. They'll ask you to start filling out kind of like paperwork that will help you with the application. One of the paperwork is called the biographical form, which you'll see I have down there. It's essentially, they took all the questions from the application and they listed it in a Word document. So you fill everything out so that when the application comes out, you already have all the information you need to complete the application. So that makes it easier for you to submit early, which is a really, really, really important point. You need to submit early. Everything needs to be submitted early. Your primary application, your secondaries, which is like when med schools like you, they'll send you a secondary application after you submit your primary application, and they essentially ask you to write another essay. And the essays kind of differ based on what school you're applying to. Writing essays sucks. I mean, that's just what it is, right? Nobody likes writing essays, and definitely secondaries. Oh my God, it was so hard. But I would still recommend you do it early. It makes a big difference because the earlier you submit, the earlier you get your interview, and I think that makes a big difference. Personal statement. I'm actually writing my personal statement for residency, so I can give you some advice that I've heard from my own mentors. One thing that you don't want to do on your personal statement is rehash your CV. So whatever you included on your, your application, the interviewers already know. So you want to give them something a little bit different in your personal statement. You of course want them to know why you want to go into medicine and then kind of like what experiences led up to it, but you don't need to go out and relist your accolades. Like, you don't need to do that. Just give them like a different perspective. I think in one of them I wrote about traveling, and in another of them I wrote about a medical experience. So it kind of just like varies. So I don't want you to feel like you have to relist everything you've already put in your application. And then for your letter of recommendation writers, you want to contact them in January so that they have enough time to write your letter of recommendation. Pick someone who knows you. So you don't need to go for a big name, but somebody who knows you and is able to write more than just good student. You want someone who knows your personality, knows how you do well academically. You can pick someone who is the mentor for your club that you're a leader for. You can pick someone who is your professor and you had a good relationship with. You can pick your PI for research. Just someone who knows you and is able to write a lot about you. So that's really important. Senior year. So senior year is whenever you want to start with like interviews. The information that the interviewers have about you from your application include your involvement, so your volunteering leadership, the hype from your letter of recommendation writers, and your scores and stats. Your scores and stats are important only in getting you the interview. So if you have like super high scores and stats, yeah, you might get interviews at a bunch of places, but you do not lock in a seat at that school with just your scores. You need to be a great interviewee. So the way that you can be a great interviewee is by relaying your personality, as a kind, humble, collaborative, confident, holistic person. They want to see that in addition to you being smart, you're a good person, you're a nice person, and you'd make a good physician, right? Because I can tell you that being a good doctor is not about how smart you are, definitely not. Your patients don't necessarily care how smart you are, they care about how you make them feel. So that part of it comes from your personality, comes from who you are. So they want to make sure that you're going to be a good doctor. Your goals, what do you hope to achieve? So what are you looking to do? So I know whenever I applied, I wasn't exactly sure what I wanted to do. I was like, I don't know, I just want to be a doctor. But that doesn't, when we say goals, we don't necessarily mean that you have to know exactly what you want to do. So for instance, you can say like, I want to, work in a hospital setting, or I want to work in a clinic setting, or I want to work with underserved communities, or I want to do women's health. Just broad stroke topics of things that you're interested in, and realize that in med school, this can totally change, and that's totally fine. But they want to see that you at least have some idea of what you're interested in. And then what are you looking for in the program? So lots of programs offer lots of things. I mean, Waqas just told you that he pursued a master's degree as part of his med school journey. So you want to kind of know if you're interested in global health, if you're interested in medical education, in public health, or in primary care, or in research. Certain schools cater to certain things. So you want to know what you're looking for in each program and what each school offers. Then last piece of advice, and I think this is the most important thing, is every single second of your interview day is part of the interview, okay? When you're eating with applicants, that's part of your interview. When you're talking to med school students, that's part of your interview. When you're walking around the hospital, that's part of your interview. Every second counts. So don't let your guard down and relax and be not professional. That really will negatively affect your interview, okay? So it's not just about what you say, it's kind of about the whole entire experience. Cool. So medical school. So as a pre-med student, I think I was most nervous about medical school because I did not know what to expect. Like, what is med school gonna be like? What does your schedule look like? How many hours do y'all work? Like, I just wanted to know all this information, and every person that I asked, they would give me like a nondescript answer, and I'd be like, no, but I wanna know. So I thought I would include my curriculum. This is the curriculum at Southwestern. So our 4 years of med school are divided into 3 periods. Our pre-clerkship period, which is the period that we are sitting in a classroom and learning, from our professors, we're studying. We have some hospital exposure, but not much, okay? So that's the first year and a half. The next year is spent in the hospital in our clerkship period. This is where we're going from one rotation to the next. So we go from like internal medicine for 8 weeks to surgery for 8 weeks, neurology for 4 weeks, and we get to interact with patients from different specialties. And that's really the time where we get to explore what field we actually like. And then the post-clerkship period is kind of where we kind of know what we want to do. And then we go to the hospital specifically in those fields. So for instance, Waqas and I are both interested in internal medicine. During this year, we're both 4th years, we are applying to residencies in internal medicine, and we are taking rotations at the hospital that are related to internal medicine. A little bit more about the pre-clerkship period. The first 6 months are kind of basic sciences. These are things that you've already taken in undergrad, like biochem, microbio, anatomy and physiology, things like that. Integrated medicine is an entire year where we learn about each system on its own. So we learn about the heart, what's right with the heart, or the way it's supposed to work, and then what goes wrong, and then how we treat it. Then the next month we move on to the kidneys. Then the next month we move on to the lungs. Then we move on to the GI system. So it's kind of like that. So that's how our curriculum is divided. This is what a typical day in my life as a first year looked like. To give you some context, I live kind of 45 minutes to an hour away from school. So I have to wake up kind of early. I wake up at 6 a.m. and I eat breakfast, I get coffee, and I leave for school. I get to school around 7:30. I spend my time at the library checking my emails and planning my day. I go to lecture from 9 to 12, type my notes while I'm in lecture, then I have lunch with friends. I start studying around 1 to 3, and that's when I'm editing and finalizing the notes that I've already typed up from lecture. 3 to 4 p.m., I have a tea break. I had a tea station at my desk at Southwestern, and people would drop by to drink tea with me. I mean, I can't get more Arab than that, but this is how I like to relax and enjoy my time. 4 to 6 p.m., I would pre-read for the next day's lecture. And then 6 to 7:30 depends on kind of how my studying went. Either I'm chilling or I'm actually studying, and then I relax at home. So this is what my day looked like. But what I really want to emphasize is that everyone does it differently. Okay, so this is what I did, but I know people in my med school who would stay up studying all night and then go to sleep throughout the entire day and just stream lectures from home. They never went to class. I know people who would, instead of going to lecture at 9 to 12, they would go to the library and stream the lectures, and then they would, go to the gym and then spend time with their friends, and they'd study more towards the end of the day. I know people who studied for 5-6 hours, like me, or people who studied for 2-3 hours a day. It just really varies. But this is what a typical day in my life looked like. Then last thing I wanted to address before we open the session for questions with myths of med school. Now, these are things that I believed as a pre-med student and that I continue to hear as a medical student. So I want to address them. Everyone is a gunner. no one will help you. So a gunner is somebody who wants to advance themselves at the cost of other people. And I hear this so much, and I think this strikes fear in a lot of pre-meds because they think that it's going to be a competition of them against everybody else. But let me tell you, med school is the most collaborative environment that I have been in. Everybody is there for you. Literally everybody. People that you know in your class that you're not really close with will offer up help. If you just if you say hey, I'm stressed about something, they'll offer up help. Everybody wants to help everybody. Everybody's on the same bus. Everybody wants everybody to succeed. And so you'll find a group of friends that you really click with, and that it's going to be like family. You're going to feel so supported. So definitely not the case. You have to be super smart to make it. This is also not true. I can tell you that I'm not super smart. I think what's made me successful in med school is that I'm hardworking. People who are super smart, maybe they have it a little bit easier, but still med school is made so that in a way that even if you're smart, it's still going to require hard work. And it doesn't, not everybody in med school is super smart. I hope you guys realize that. That's definitely not the case. We were all like you guys when we were in, undergrad. We were all the same people. It's just all the same group. So you definitely don't have to be super smart to make it. That's not the case. You won't have a life. I hear this one so much. And this one, I think I was most afraid of when I was going to med school. I was like, oh, my life is going to be over. I'm not going to be able to have tea and coffee breaks with my parents, or I'm not going to be able to attend so-and-so's wedding or whatever. But I have never had to put anything or say no to anything because of med school. In my entire 3 and some years so far, I have not had to say no to anything because of med school. Definitely not the case. Med school is a trial run for your life. As a doctor, you're going to be busy. You're going to have so many things to do. But on top of being a doctor, you're going to be a parent. You're going to be a friend. You're going to be, a coworker. And so we're balancing all these different roles. And that's the same thing in med school. I'm a student, but I'm also a sister. I'm also a daughter. And I make time for other things because other things are just as important as med school. So I would say you can have a life. You definitely should have a life. All it takes is a little bit more time management skills. Yeah, so don't worry about that. I know people play volleyball every single weekend, or they play table tennis every day. They have basketball leagues at Southwestern, and people are living their best lives. You will be stressed all the time. This one is not entirely true. So you will be stressed. There are times where you will be stressed. I think the first not 6 months, I would say first month as you're adjusting to med school can be stressful. Definitely, because it's such a different style, different kind of environment. It can be a little bit stressful. So there will be times where you're stressed. When you're studying for your board exams, for instance, right now I'm studying for my boards exams. And even though I'm studying for my boards, I wouldn't say I'm stressed, but it can be stressful. So it comes and goes. Your life is not stressful all the time. There are certain moments where it might be stressful, but even when it is stressful, there's so many people around you that will support you. So it ends up being okay. All right. So that's basically the overview of everything that we have. We're gonna field some questions. So I'm gonna go take a look through the chat box and we're gonna start answering questions. I'm gonna just sling them out at the panelists and they'll hopefully give you answers to any questions that you may have. If any of your questions are not answered, you can always email me at my email over here, aseel.dweik@utsouthwestern.edu, inshallah. So let me get the panelists to participate. I hope this was helpful. I know that it can be really stressful for people involved, whether that's parents or students themselves. But inshallah, you got something from this. Waqas, are you able to speak?
Yeah, I'm here.
Great. And Samar, are you able to?
By the way, Samar is on.
Hey, Dina.
Hey.
Okay.
Oh, there we go.
Perfect. Sorry about that, Samar.
That's okay.
Okay. Do you want to just introduce yourself really quickly, Samar?
Yeah, sure. Assalamu alaikum, everyone. I'm Summer. I'm a second year at TCOM, which is the College of Osteopathic Medicine in Fort Worth. And yeah, I just started my second year, and it's a little different because of COVID and everything, but I'm super excited to answer you guys' questions. maybe some of the DO questions.
I did want to ask Summer a question I think that people might not think of. So I mentioned that bachelor is usually 4 years, and then people are kind of confused about what degree they should pursue, and then people try to go into med school. I know Summer took a little bit, I know you took a little bit of a different path. Do you want to talk about that a little bit? I think it's super important.
Yeah, sure. Also, sorry guys, I'm in Houston and it's raining, so just excuse the thunder. But I graduated from University of Houston, and it took me 4.5 years because I majored in finance instead of doing a science major, just because I was thinking that I wanted to have more of a business background, and I did want to go to med school the whole time, but I just wasn't sure if a science degree was for me. So it took me a little bit longer because I had to fulfill those extra classes, but I think it was so worth it because when I graduated from college in December, I had an extra 6.5 months to kind of relax, take a gap semester, and then I started medical school in July. So you don't always have to follow the 4 years of college, 4 years of med school route. You can take a little bit longer. Not everyone's route is perfect, but as long as you get to your destination, I think it's worth it.
I think personally, I didn't take a year, in between, but I think if you're able to do that and you're okay with doing that, you definitely should. It's a lot of great time for you to kind of explore again what things you like outside of medicine. And so I think if you're able to do that, that would be wonderful. And I know a lot of people are stressed and nervous about doing that. Like, I just want to get into medical school. But trust me when I say that year will get you so much in terms of experiences that you might not get afterwards. So I would recommend it. So I'll ask
to travel, hang out with your family.
Yeah, just to live your life. I'll ask the first question. What is the process of getting to volunteer in the ED? Do any of you guys want to take it?
So I think with COVID right now, it's probably a little bit difficult to do that. But I did see on Reddit, someone posted a virtual shadowing thing. And it's actually led by someone from Southwestern. So you can actually go online every week, every Friday for a couple hours. You can actually do some kind of virtual shadowing. Just go and look that up and you can get involved there.
When COVID ends, usually the application process is through the hospital's website. So you can go to any hospital's website. I volunteered at Medical City of Plano. I went to their website, found the volunteers tab, and was able to volunteer through there. Okay. Any advice to find extracurricular opportunities in this time of COVID and uncertainty, since it's not exactly safe to be out? So I think we answered this. Perfect. Okay, you saw the slide. Awesome. What is MCAT? So that's a really good question. Do any of you guys want to take it? Dina?
So the MCAT is the college admission test. So basically it's the exam that every student has to take in order to apply to and be accepted into medical school. It kind of covers several different subjects that you study during college. So it covers like biology, biochem, chemistry, physics, English, psychology. So it's a very broad exam, and students usually take a couple of months, like Aseel said, to study for it. And it, along with students' GPAs, are usually a big part of what med schools look at in order to supplement the essays and other things that are in the application.
Thank you. This is a really good question. I think this is something that we didn't cover. So what is your take on combined BS-MD programs? For those of you unaware of what this is, it's essentially an application to be part of a program that combined a bachelor's degree with a medical degree. This is available at a few schools. UTD used to have one, but I think this program is no longer available at UTD. I think San Antonio has one where you're able to directly link from your bachelor's to a medical degree. So do any of you guys want to answer this question or have thoughts on it?
Personally, I think that, I don't know if they're the best. I mean, they're an option, but I guess when people ask me about them, I usually don't recommend them because I feel like they don't give people as much flexibility in what they can do in college. So they're limited, from what I know, they're limited in their major, and then they have to do 3 years of college instead of 4 years. So it's very rushed. And for me, like, there were a lot of classes that I took in college that had nothing to do with science, and I really felt like those helped me grow. And I don't think I would have had that opportunity had I done like a 3-4 combined program. But I know that there are also positives to it. So if anybody wants to talk about that as well.
You have a couple of observations on it and thoughts. I mean, for one thing, obviously it was great to get a guarantee to med school. I mean, obviously, like, you don't have to worry as much about the MCAT or applications or rec letters or all those things. So obviously it reduces a lot of anxiety in that sense. A lot of people I know who got to a lot of the BSMD programs, like in Houston and San Antonio, I mean, there's students who definitely, I mean, like, obviously every med school is great, right? But these are like really, really talented students who probably had a chance at some really, really competitive med schools had they chosen not to do the BSMD. Because once you do the BSMD, you kind of got to go to the same med school as a college. That's one thing. And the second thing is that in like some of the BSMD students that I've seen, some of the students, because I've seen some BSMD students who have had to repeat a year because they come into med school like not having really tried as much the past 2 years and applying themselves. So that can be a challenge, but there are also a lot of pros as well.
Yeah,
Yeah,
and
I'm sure the pros, like getting a guaranteed admission, is a big deal, and it's not something to just like dismiss.
if you do want to do it, I would say you would have to be really committed to doing medicine. I know a lot of people think they want to do medicine when they go into college, but they found that they like something else. And so I would say consider it if you're really interested in medicine and there's only one school that you want to go to, and that's the school that, you know, the BSMD is linked to. Otherwise, you're really limiting yourself like everybody else said. So what is the targeted minimum score for MCAT at Southwestern?
I think there isn't like a minimum, but I think there's like averages for schools.
Yeah.
So that's present on every school's website. Like you can find their average GPA, average MCAT. I'm not sure what it is for Southwestern though.
I would say MCAT, I've seen there's a huge range in my class. So there are people who make 500, you know, 2s and 3s. There's people who made like 527. So it's really variable. I don't think there's a score that you have to target. I think if you do, you know, above average, I think you're sort of setting yourself up pretty well. I think I believe, but don't quote me on this, I believe our average is maybe 512, but I could be wrong. Okay. Is the MCAT the primary thing you guys focus on to get into Southwestern? No, definitely not. Does anyone want to take this question? I guess
also doing well in your classes, getting a good GPA, getting involved. That was something that was really, really important to me in college. And I felt like it was something that I talked about in a lot of my essays.
Yeah.
And those things are really a big deal for getting into med school.
Yeah, I definitely agree. And like, it's not like you just do things to get into one specific med school. Like things that you make so competitive will make you more competitive for most med schools.
Yeah, and also, like I said, like MCAT may be able to get you an interview at that school, but you're not gonna secure a seat if, you know, you don't really do well in the interview part. I think that's the most important part. So, why did you choose UTD? I think this is maybe directed towards me. I chose UTD because it was close to home. I could live at home with my family, which was really important to me. And I just knew that I wanted to go to med school, so I didn't feel like there was a need for me to go outside in order to get somewhere so close, essentially. And it's a great school, and I love the vibe there. It's very diverse, and it has a lot to offer, so I really liked it. Yay for UTD gang. How many letters of recommendation would be good? Anyone want to answer this one?
I think that also depends on schools, or maybe the application itself has a certain requirement for letters. I remember like getting one from a doctor and one from a science professor, but I don't remember how many total there were.
I think I did 3. And in some secondaries, like TCOM, for example, they had us do an additional letter if we wanted. So if you get an additional letter, you can add that to a secondary. But I think they say the golden number is usually 3 to 4.
Okay. When applying to college, does it matter if you went to a grade school or can you go to any college?
Or go to any high school, I think it says.
Oh yeah, go to any high school, sorry, yes. So I think you can go to any high school. Again, it really matters about you as an individual rather than where you were. I think that's the most important thing. So, you know, I, for instance, went to Brighter Horizons Academy. I know a lot of people who went there were maybe nervous that, oh, you know, I'm going to a private school that's less well known, doesn't have as much extracurricular. Will I be, you know, as competitive as, you know, people who go to public school and have like, you know, a lot more opportunities? And I would say no. It's really about you and who you are as a student rather than what the school is and what it offers. Okay.
Yeah, I think it also depends on how competitive your school is. Like if you go into like a random school and like you're like ranked 2 or 3, that might still be the same as going to really competitive public high school and only being in the top 5 or 10%. So they look at all those factors when they do college admissions.
Okay, the next question is the pre-clerkship period focused so you know what you want to focus on, or do you find out more during the clerkship? Pre-clerkship is very broad. So I think you learn a lot about a lot of things, but clerkship period is where you're really exploring. Pre-clerkship is maybe where you start getting an inkling of like, oh, you know, I really enjoyed learning about the heart more than I enjoyed learning about like the reproductive system for like OB people. You know? So what do you recommend for someone who is stuck in fear while applying to medical school and delaying completing secondaries, feeling pressure to write perfect essays? Wow, cannot even relate more than what I already relate. Like this is a big vibe. I am delaying like nobody's business. I feel that so hard. Amira, thank you for that question. Does anybody want to answer this question?
I think there is definitely a lot of fear and pressure. Maybe try giving yourself time every day. So what I did, I remember, is I just wrote like a stream of consciousness for essays and just wrote anything that came to my mind and didn't worry about like making sure it looked good or like sounded perfect. And then I would come back to it like the next day and then pick and choose from it and then build upon the different ideas that I thought about. So yeah, it's a long process, but you can do it, I promise.
Yeah, and most med schools tend to do rolling admission. So like the earlier you submit, the more advantageous it is for you for getting a spot. So I would keep that in mind, inshallah.
And it's okay if your essays aren't perfect. I feel like we put a lot of pressure on ourselves that we have to be the best, but step away a little, give yourself some time to relax. And then if you look at it with like a fresh set of eyes, people always say your mind is more clear and you end up writing better.
Yeah.
There will always be, like, you'll always find something in an essay that you want to keep changing, but at some point you just have to like I guess like it the way that it is and say that this is as good as it's going to get and submit it and be happy with it and leave it up to Allah.
Yeah, I was definitely stuck in a rut. I was trying to write my personal statement for residency applications. I think something that really helped me was I made an outline of what I wanted to do, and then I called a friend and I asked her for her opinion of my outline. And you know, she's the kind of friend who will tell me like, no, this sucks, like you need to change it, or you know, someone getting another set of eyes to look at your ideas can not only help you identify good ideas, but can also help identify a better structure or a better way of relaying the information that you're trying to say. And sometimes people will remind you of how amazing you are. Something that, you know, you might forget on the day-to-day, especially when you're looking around and everyone else is perfect. So I would say get another set of eyes. That might also be helpful. A lot of people say not to take biology as a major as an undergrad. Do you know why this is not recommended?
I think it's because people say that you have to take like random zoology classes and like things about plants or something. I don't know.
I've also heard
that's not
that,
relevant.
Oh, sorry, go ahead.
You can go on, sorry.
I was just saying I've heard that a lot of people try to avoid biology just because it can affect their science GPA if you're not super good at it. And people who graduate and then they're waiting some time to get into med school, it's hard to find jobs with that degree. But again, if you have like a lab or something like that, then it's not always a bad option. But I've just heard that the job market's like.
Yeah, and in addition to that, I think like some people like to stick out for the sake of sticking out. But like even if you do like an arts major or economics major or finance major, you got to be able to like justify why you did that as well, and not just do it for the sake of doing it. And you can still do a biology major and do a lot of clinical research, do a lot of cool things that show why you're passionate about biology as you apply to med school.
Yeah. If biology is something that you like and you're interested in pursuing, and you want to go to med school, do it. But if you're just doing it because you feel like you have to do it for med school, then maybe consider pursuing something that you actually really like. But I don't think you're at a disadvantage if you take biology. It just means that you're going to be taking a little bit maybe harder classes that you would have to study more for, in comparison to like business classes, Okay, what's the difference between a DO and an MD? Which one is better? I can start with this question. So neither is better than the other. They're essentially the same thing. It's just different principles. So both MDs and DOs fill in the same positions as physicians. So you could go to the emergency department and find someone who has an MD and find someone who has a DO. Samar, for instance, you're going to TCOM, which is a DO school. So could you tell us a little bit about what and how your curriculum differs maybe a little bit from an MD program?
Yeah, so kind of like you showed your Southwestern outline of what the classes you guys take, we have the same similar concept. We do 2 full years of basic sciences and disease. So we learn about all the body systems and we learn about what goes wrong with those systems. But in addition to that, we also learn something that's called OMT, which is Empathic Manipulative Techniques. So the cool thing about that is it has like a different approach of treating the person as a whole. And the principle is you can use your hands to use like a non-invasive method. For example, if someone has irritable bowel syndrome or they have like back problems, which is pretty musculoskeletal, there are some tips and tricks that we learn in each class that can teach us how to treat those patients. And it's a cool process. I wouldn't say, again, after we know D or MD, that one is above or below the other, but it's a cool skill set to have, and it can help your patients in the future. If you don't want to prescribe the medicine, you can try to treat them with your OMT. Or some people don't use OMT as DOs, but it's just a cool thing to learn, I think.
Yeah, just a little bit of a different philosophy, but essentially pretty similar practice later on down the line. The application process, does it differ? I don't think so, no.
No, it's pretty much the same. We use TMDSAS for TCOM, and I think they added another DO school to that, but there is AA COMAS, which we use for all the other DO schools in the US. So if you want to, kind of spread your horizon out, you can apply to both MD and DO, and do your research on the schools, because some schools have curriculum set up different ways.
What do you think about healthcare studies at UTD, since you actually went to UTD? So I actually did a healthcare studies bachelor's, and this is what I have to say. If you are for sure 100% going into a healthcare professional degree, it's an okay degree to pursue. You get to take a lot of like different classes. But if you're not 100% sure and then you graduate with this degree, you're kind of limited in what you get to work or what fields you get to pursue after. So I would say do it if you're for sure on medicine and you want to just bridge yourself. But if you're not so sure, I would pursue another degree just to make yourself like in a safe spot. I actually recommended my brother against it because for that exact reason. There was a period in time where he wasn't exactly sure. And so I told him just do a degree that you could work with if just in case you don't go into medicine. So that was my recommendation. It offered a lot of really interesting classes that I'm really happy that I took, but you just got to be sure. The school is offering a combined BS MD program, but the condition is that you have to be a DO. Is it worth it? This is kind of like similar to the other question that we had. Really no difference between MD and DO. Just kind of more of a question of whether or not you want to do a combined degree. Doesn't matter where you go to obtain your undergrad degree. No. Would you guys agree?
It kind of matters. I mean, so I think in Texas it doesn't really matter. So if you go to UTD or UNT or Austin College or UT Austin, you're pretty much competitive for all the Texas med schools. But if you want to go to like Harvard, Stanford med school, like they do tend to take students who go to Ivy League colleges. But aside from that, it wouldn't matter.
Again, though, I'd emphasize that it's more about you as an applicant. So, I mean, my friends at UTD are now at Johns Hopkins and Yale med school. You can go to top schools from, any undergrad, but yeah, maybe having an Ivy League degree would make the process a little bit easier for you. But if you're a good student and you want to go to top schools, I think you can do it from any undergrad. What program would you recommend as a rising senior to try to apply to 6 or 7 7-year med programs? I'm not familiar enough with the combined degrees to be able to give you advice. Do any of y'all know?
I think there's one in Lubbock that's connected between
Austin College, right?
Texas Tech, I think, or I don't know, Texas Tech and the med school there. So that's an option. There are only a few options in Texas, so I think you can just Google it, and it should be easy to find information about them. I don't know about Austin College.
No, I think I got rid of it actually. Sorry. Yeah.
Okay.
Yeah, sorry about that.
Okay. Does Southwestern offer many full ride scholarships? And what are criteria for achieving these? I'm not sure. Do y'all know?
I've heard of some people getting half ride scholarships who are like underrepresented minorities, but I'm not sure. Not sure.
Yeah. I'm getting a lot of questions about the presentation. The presentation will be available through AMWPA. I'm having it recorded, so inshallah you guys will be able to access that. A lot of questions about like degrees to get into schools and whether it affects what school you go to. Again, you at every single med school you'll find people coming from really different degrees: econ, finance, healthcare studies, business, engineering, all flavors. So there's no certain degree that makes you a better pre-med applicant than another. Can you make a timeline of your med school years 2 through 4 as well? So second year, the first half, we're still doing our system. So we're learning about like the heart, the lungs, the kidneys, things like that. The second half of second year, we're in the hospital rotating. Same thing with third year, kind of rotating through the hospital. And then fourth year, we're applying to residency. Okay. Samara, you're getting some questions about the UNT 4-year program. Do you want to go over that a little bit?
I didn't go to UNT for undergrad. I'm not sure the 4-year program is like the undergrad there, but I went to University of Houston.
Oh, okay. Sorry about that. I thought they meant
I'm not sure about the usual one. Sorry. Yeah, the DO program is 4 years.
Oh, okay. Okay. For high school students interested in the medical field, do you guys have any other advice aside from what I mentioned in the PowerPoint?
I think what you said kind of covers it. Like, it's a good time to explore your interests and don't like limit yourself or put yourself into a box that you're going to for sure going into med school. Definitely take the time to explore career fields and make sure that you're like very content with your decision or happy with your decision to do that.
Do any of you guys have experience with marriage life while going to medical school? I don't have any personal experience with that, but a lot of people in my class are married / engaged / have kids, a lot. And they do it both, I don't know how they do it, to be honest, like hats off to them. But they do it, and I wish I could give you more advice on what it's like, but I think it's just a lot of time.
I find that the like my classmates who are married or have kids do med school better than anybody else because they're really, really good at time managing and like knowing when they're going to study and when they're going to go home with their kids. So it's definitely doable for sure.
How do you shadow as a senior applying to BSMD programs? I would say it's the same. Essentially, if you're a high school student, I would still recommend, you know, AMWPA shadowing. Maybe you go to the hospital because you have to be pretty sure. So getting a better idea. What type of research did you do with your professors at your college? Did any of you guys do research, and if so, what did y'all pursue?
I did research with the biomed engineering department. So we did research on lupus nephritis biomarkers. It was really interesting, and the professor was really nice. I think if you find like a really good professor who supports students and undergrad students, then it's a really good opportunity.
Yeah, I did bioethics research with the Center for Values in Science and Medicine at UT Dallas, and that was a really cool experience where I got to sort of examine evidence-based medicine. And one more thing about UTD, if you all have heard of the C5 program, I'd highly recommend you join that. The class on medicine and politics philosophy was definitely one of the best classes I took there.
Can you do military and med school at the same time? Yes. I think
I'm not sure.
If you join the military, I believe they pay for your med school, but the condition is that you have to serve for 4 years, I think, in a veteran hospital. Okay. If you're graduating a year early, can you take MCAT the same year that you're applying? If you're graduating, if you're going to be taking 3 years and you'll be graduating as a junior, you want to take your MCAT January of sophomore year. Any suggestions on how to finance for med school?
Look at ACC, a continuous charity. It's an organization that's co-founded by Dr. Arthur Huck, who's the doctor at UT Southwestern, a Muslim organization that seeks to provide interest-free loans for Muslim students. So that can be one way of financing your education.
I have a question.
Sorry, what was that called?
It's called ACC, a continuous charity. I think the deadline already passed for this year, but for next year you can apply, inshallah.
I'm getting a question about whether you can pursue an engineering degree. Yes, you can definitely pursue an engineering degree. Lots of engineers in medicine, if you want to go to med school. PA school versus nursing school versus med school. Y'all's thoughts?
I guess for nursing versus med school, like it depends on what role you want to take in the healthcare team. So, and they also all have different education requirements, different graduate school requirements. So you'd have to look into that and see what aligns most with what you're interested in and what your career goals are.
Nursing is more like hands-on time with the patient, kind of like bedside stuff. And then if you want to, I think PAs I've heard are really enjoying their field because they sometimes have very similar roles as physicians, but at the same time they have the ability to, I think, change specialties when they want. So PA school I've heard is really cool too. It's competitive, but again, like Dina said, it just depends on the role you want to take on with the patient.
Lots of questions, but we'll answer a few more, and then inshallah we'll have to like close out. I know there's some questions that are still unanswered, but how should you build relationships with your professors when all classes are online? This is a really good question. I would recommend, most professors will have online office hours. I would recommend you go to every office hour and ask a question. It doesn't have to be something that you don't know. It can be even about something that you do know, but I think that builds a good relationship with your professors, and they'll have like face recognition of who you are, and they'll be able to tell that you're hardworking. So I think that's one way that you can build it. So go to the online office hours, every office. I used to do that with my professors. I would go to every office hour, just so that they know who I am, especially in a class where there's like 200 or 300 students. You really want to put effort to stand out. Lots and lots of questions.
One question is, how long does it take to become a doctor if you do family medicine? So the residency programs, they range from, all of the residency programs range from 3 to 7 years. So family medicine specifically is 3 years. There are some that are 4 years. Surgery is like 5 years plus fellowships. So it depends on the specialty.
I think Texas Tech has a condensed MD family residency program where you save a year if you do it.
Cool.
What is the average tuition cost per year for most students? I think that'll be our last question, but I think that's a good question because I didn't know when I was going into med school. I think for most Texas schools, rate is like 20 to 30 grand a year. Is that correct, y'all?
Yeah, you can find it on their websites as well, I think. I know TCOMS is 20 for the whole year, your first and second year. But other schools, and I think the information's on their website, like first year this much, second year this much.
Yeah, a lot of the information about each school is found on like their admissions website. So that's where I recommend a lot of people should go. It answers a lot of the questions that are being asked.
Yeah, definitely do your research on the school. They have so much of the information that you kind of are interested in knowing online. And I think a lot of schools are going to try to put more information virtually, especially in this situation. So they're going to make that information available to you so that you're able to make a more well-informed decision. So definitely check out their website. I'm sorry, guys, there's so many questions, but it doesn't look like we're going to be able to answer all of them. Like I said, if you guys have any extra questions that y'all want to ask, you can always email me. I'm available to answer your questions. I know that AMWPA is a similar event for dental students. So if you guys are interested in that, or who are interested in that, just know. I want to thank all of you for coming, and I want to thank my panelists for helping out with answering the questions. I think hopefully, inshallah, you guys were able to get a lot of benefit from this. And inshallah, if you guys have any questions, we're all available to help you guys out. So I'll go ahead and end it here. And again, please feel free to message me.
Thank you.
Thank you, guys.